Welcome, everybody. I'm super excited to be interviewing Dr. April Graham from Blue Heron Natural Medicine. And welcome, Dr. April. Do we call you Dr. April? Do people call you Dr. April?
Yeah.
Yeah.
Yep.
Okay.
That seems to work well.
All right. Sweet. So I know a lot of our viewers probably know what a naturopath is, but I would love for you to just kind of give us an overview of what a naturopath is and maybe how you differ from other medical doctors.
Yes, absolutely. So as a naturopathic doctor, we seek to treat the cause of the condition that someone's coming in for. A naturopathic doctor has very similar training to a medical doctor. Like we have to do our pre-med, and then we go to a naturopathic medical school where the first 2 years we learn about, we do all the same like cadaver lab, biochem, all those, that same core coursework. And then the last 2 years, we're also learning conventional standards of care alongside other more traditional therapies like herbal medicine, homeopathy, physical medicine, hydrotherapy, counseling, and whatever else we can seem to fit into our toolkit. So we also just have a very different philosophy of healing. We do believe that given the right conditions, the body can heal itself. So oftentimes that means more subtle medicine or, like slow medicine where, we're going at the pace that the body wants to heal, as opposed to, bringing in a sledgehammer when that doesn't need to be brought in at that time. Sometimes we need a sledgehammer, absolutely. But, oftentimes we don't. So I think that's where we come in.
Awesome. And so when you talk about a sledgehammer, like, does that mean like Western medicine or like, what does that sledgehammer mean?
Yeah, so I was thinking along the lines of, like heavy hitting drugs, even as simple as a statin or blood pressure medications, those kinds of things that seem to be prescribed quite often, or even when talking about pain, like ibuprofen. When, to the body, I think a lot of times, that's a lot. You're changing what the body wants to do. And so that's kind of coming in from my viewpoint and sort of overriding the body's natural processes. And when we do that, then we might develop symptoms in another area, or like another really good example of that would be like, a proton pump inhibitor for acid reflux and those kinds of things. So we got how to override the body's responses in Western medicine, but oftentimes we don't need to do that. But I think sometimes we do. Another version of a sledgehammer would be surgery.
Right.
I actually am very grateful for the sledgehammer because I needed to have an emergency C-section when my child was born. And so, that really instilled in me an appreciation of conventional medicine. And I very much, believe that we need that heroic medicine. And I'm very grateful for that. But it doesn't always need to be like that. So I feel like we really help to fill in that gap.
Absolutely. I agree with you. And, my practice, I'm very similar in that respect, is trying to help the body do what it needs to do and releasing restrictions and all that stuff to, like the proton pump inhibitors. So if I'm doing work on someone's hiatal hernia, sometimes it's a mechanical thing that can be fixed without the drugs, which, cascade into a whole bunch of different side effects and other things like that, or put you at risk, right? Proton pump inhibitors, you're not supposed to take those for long term, right?
Yeah, exactly. They deplete, all kinds of, we need stomach acids to digest our foods. And so if we're not having that, then that can lead to all sorts of issues as far as nutrient deficiencies, particularly B vitamins, but also just, what's happening to all those foods that aren't getting completely digested in the body. So that can lead to microbiome issues and things down the line.
Awesome. So, what got you interested in becoming a naturopath? And just tell me about that journey for you.
Yeah, absolutely. So I was working for Microsoft doing their in their ergonomics program, and I was also aspiring to be a professional mountain bike racer. And I actually did did eventually make it kind of to the pro ranks. But simultaneously during that time, my dad was also very, very sick with colon cancer.
Mm.
So so I was, there for him during his appointments and things. And I was just always so discouraged with Western medicine at that time because they didn't, I would always bring up, what about taking this supplement or this or that? And they were just like, no, no supplements at all, no, nothing. So, they're having him drink Ensure to get his calories. I mean, to some extent, I understand. I do understand that. I understand where they're coming from now, I should say, even more. But at the time, I really just felt like, wow, isn't there a better bridge? And also, he really, like, this could have been prevented had people had, some of his doctors maybe known to screen or were more diligent about having him do a screening, specifically colonoscopy. And also, I believe now that the cancer also could have been prevented way earlier on in life because due to the mind body connection and his mental emotional issues. That if someone could have really helped him with that early on. And so on so many levels, I saw how things could have been done differently in our system. And I had to stop mountain bike racing after he died because I literally couldn't even put like one pedal stroke in front of the
Oh,
other. Like it just, I had my back pain was excruciating. So I also saw that connection between stress and the physical part. So I grieved. I grieved for like 6 months, just really trying to figure out what it was that I was going to do with my life because I wasn't happy at my previous job. And so, I just came to realize that I needed to be in medicine and wanted to learn how the body healed. And I did not believe I was going to understand how the body truly heals by going through conventional medical school.
mhm.
So when I went into naturopathic school, I really went in with that lens of how do we get sick and how do we heal. So that was really my mission, trying to understand that. And navigating those waters in naturopathic schools, even then, it's a little bit muddy. Um, but so you have to find the right things that resonate with you and all of that. So I do feel like I came to understand that, and now I'm able to share that with people.
Well, thank you for sharing that. I'm sure that was probably hard to revisit. And, I know a lot of practitioners have become practitioners because of, a tragedy or something that happened to them or a family member or something that, it's really inspiring. So your heart must be in your work. I can tell from the way you talk about it. So that's really lovely. Um, so talking about the body and how it heals, this group is for women, and we talk about lots of different aspects of becoming or being a woman, and what isn't around that. And one of the things that and this month we're talking about the female form. And so when I was thinking about the female form and our female bodies that are something specific to the female, hormones comes up for me, because we have different sex hormones and other hormones that are guiding and manipulating our bodies in many different ways, and it can be very confusing to people. So I know when I looked at your website that hormone balance was one of the things that you offer, and so I would love to kind of find out how you are able to support women from different aspects in different stages of their lives. Like, I deal with a lot of women that have PCOS and endometriosis and PMS kind of things, and then perimenopause and menopause, and of course, selfishly for my own knowledge, I'm going through postmenopausal symptoms myself, and so just would love to delve into some of that with you about how we can help the body and how you help the body specifically in that realm.
Yeah, absolutely. So with all stages of life, I mean, there are so many different hormonal issues that can happen. Earlier on, it's like, heavy menstrual periods and acne and PCOS and these kinds of things that tend to show up. And with that, it's like, I never just treat the skin, right? So if someone comes in for like say something like acne, I'm not going to start there because I want to know what the cause is. And so oftentimes, in that stage of life, we're producing a ton of hormones and our liver just can't seem to keep up with the processing. And so it comes down to supporting the liver a lot of the time in hormonal cases at all stages. But that's one organ system that I really tend to look at. And also supporting the GI system as well is extremely important. So when somebody can, particularly like with maybe something like infertility or menopause, maybe menopause, or even just moodiness and that sort of thing, we can test hormones. I pretty much always do some blood thyroid labs on people just to kind of get a sense of where things are going there. But there are specialty lab testing that we can do, like for example, the Dutch hormone testing. You may have heard of, or some of your listeners probably have heard of the Dutch test. So that can just really help us to hone in on like particularly, what is that balance looking like between estrogen and progesterone, and also looking at cortisol, which is more like your stress hormone, because that one totally plays into your estrogen and your progesterone and your thyroid. They all really go together, and it's like this dance and this balance. So really understanding what's happening in the body, the testing can help. Not everyone wants to go that level because it is a big expense to do the testing. So oftentimes I can just go off of symptoms too, just to try to understand what system needs support. Is it the liver? Is it the gut? And oftentimes it can be, nutritional deficiency. So like, for example, here in Colorado, we live in kind of a goiter belt. So
interesting.
think about like, the thyroid, think about kind of the mass on the neck, that's a goiter. That tends to happen when our bodies don't have enough iodine. So there's not a lot of iodine in our soil here in Colorado like there is maybe closer to the ocean. And so that can really affect the thyroid if we don't get enough iodine. So, prior to putting someone on thyroid hormone, I think oftentimes there's some steps that are missed, like, let's look at your nutrition, and, are you getting enough iodine or like tyrosine, which are necessary for your thyroid hormone productions. And also looking at, are you getting enough vitamin D and this and that? And if not, is it because you're not eating that, or is it because you're not digesting well, you're not digesting your foods well? So that's kind of where healing the gut might come in. And so with that, I do look at food intolerances, and I have a unique way of looking at that, but just trying to figure out, is there a food that this person's eating that they're just not digesting well? Because that can lead to kind of a toxic situation in the gut where we might be, our microbiome, our bacteria might be producing toxins that then, are creating inflammation in our gut. So, so those are just kind of a few ways I might start. But then I also, you do use a lot of herbal medicine as well. So, lots of different herbs can be really, really helpful with, and also fatty acids for hormones.
Awesome. So when you, first of all, can you tell me so I was just researching a little bit on the Dutch test. What does it stand for?
Yes, it's dried urine test for comprehensive hormones. That's what it stands for. And some of the Dutch tests also, there's an option to use saliva as well. So you're using dried urine and saliva. And the unique thing about using urine is that you're actually able to look at not just the hormones that are in the blood, but you're looking at the metabolites. So by looking at the urine, so it's like, what are these, leftover pieces of the hormone that have been processed through the body all the way down into the urine, that you can kind of get another angle, another understanding. And that's why we'll match that with the salivary, because then you're getting something that might be a little closer to what might be like similar to a blood test, so that you can see how you're utilizing your hormones in your body.
It sounds so complicated. and I know for myself, like I'm doing bioidenticals right now. And I'm having a hard, like the first week or two, I was like, whoa, this is miraculous. I'm sleeping and my vagina's not as dry, and I'd actually helped
Wow.
with constipation, and my hot flashes were gone. But after I've been on it now for a month, my hot flashes came back with a vengeance, and some of my other symptoms started coming back. So it's like, I think it's a really tricky thing to figure out. And I guess, in this short interview, and I know you mentioned like you look at the liver and everything, but like how would you determine if you didn't do a Dutch test? Like, how would you determine what might be at the root of it? Like, how would you look at like if I have digestive issues that aren't really that big of a deal, or, how would you test the liver? And just kind of give me a brief little overview of that. I know
Mm-hmm.
that's kind of a
Yeah.
lot. I didn't really ask it in a good way, but you kind of understand what I'm getting
No.
at, right?
Right. So like, yeah, like specifically with hormone balance, like which hormone to kind of go after and support, you mean, or like which organ system or
Yeah,
what?
like just what would you look, I guess, where would you look first? Or, if I was coming
Yeah.
to you for hormone
Okay.
stuff, like what would you want me to do first?
Right. So in my physical exam, I do a few like naturopathic type diagnostic, or I shouldn't even say diagnostic because it really is just more like pieces of the puzzle that I'm putting
Mhm.
together. So one of those things I do is I'll test for Chapman points, which are like little points on the body that correspond to different organs that tend to just get inflamed. So I'm sure that you have run into these with the work that you do, where you're working on someone's abdomen, and then you find like, wow, that is a really tender spot for that person, and anatomically why that would be tender. um, and sometimes they're not right on the organ, they can be a little bit off the organ. So
Mhm.
that can kind of help to guide, as far as it helps me mostly figure out, like, do we really need support with the stomach or the liver, gallbladder, small intestines? So that's one way. I
Mhm.
also lately have been, I'm not an expert at this yet, but I am looking at people's irises. So there's the iridology, which is an old form of looking, where we have like little spots in our irises that it's just like looking at the tongue, like an acupuncturist looking at the tongue and being able to say,
Mhm.
if you have these certain things going on, it corresponds with these organs. Or a reflexologist looking at your foot and saying, oh, it's tender here, that's, relates to your liver. So we can actually do that with the eyes. But what's cool about the eyes is that it's our eyes are dynamic. Like, there's healing happening all the time. And so, I had someone the other day where I could just very much tell that they had little spots on at like 12 o'clock on their irises, which is pituitary and hypothalamus. And
Interesting.
so that really helped me point in the right direction with her. Like, yeah, we could start with the thyroid, but our thyroid stimulating hormone is actually made in the hypothalamus and the pituitary. So I'm like, well, we're not going to, based on this, it kind of just nudged me and guided me
Mhm.
to, this is where we're going to start with you. Um, and I have a lot of other just kind of little things like that I do in the physical exam, just to help me understand where we're going to start, because it is so complicated. And
Yep.
the Dutch test is beautiful because it gives you all these like really pretty dials and helps you really kind of, it's one way of understanding things. But with that, I treat the person, I don't treat labs. So I really like to use kind of a combination of all of that to make a decision.
What I'd like to, if you could kind of enlighten us a little bit about bioidentical hormones, and when you would want to pursue that, when you might not want to pursue that, and some guidelines there. And what are they? What are bioidentical hormones? Because I think people get confused by that a little bit. So if you could just shed a little light on that, that would be awesome.
Yeah. So when you are given hormones, like if you're given the oral birth control pill, they're going to be often, they're made of synthetic hormones. Whereas bioidentical is just a little bit more recognizable by our own body and better able to be used by our body. So, I don't keep in mind that I'm not even allowed to prescribe bioidenticals here in Colorado. So, speaking to that isn't necessarily my expertise. But what I would say is that I do believe that there are a lot of things that we can do before going that route. Although I know how much they can help people, like all the things that you listed. It's like there's so much
Mhm.
that they can help you with. Um, but for me, I think before, if I could prescribe before I did, or if I had a patient who was very interested and I was going to send them to their medical doctor to, determine if they were a candidate for that, I would probably run the Dutch test on them because I would want to know, because with the Dutch test you can see breakdown of different types of estrogens, and so I'd want to know are they producing more of a dangerous type of estrogen or more of a benign, helpful type of estrogen. So you can actually kind of see that. And I would also just want to know family history wise, any family history of, breast cancers and things like that. And then, what is the risk for osteoporosis? Because bioidentical hormones can be very helpful for osteoporosis. So it's always, really balancing for that particular patient what it is that's going to work best for them. Um,
Mhm.
but yeah, I would give, if you're in menopause and experiencing symptoms that you're not happy with, like vaginal dryness and hot flashes and moodiness and all that kind of stuff, I think it's appropriate oftentimes to start with lower intervention. One thing that is very low intervention and very very helpful is something called biotherapeutic drainage. So it's like particular homeopathics made in such a certain way that they synergize together in order to stimulate the cells to actually start releasing, uh, sort of detoxing and helping with the drainage of just all the stuff in their cells that they need to let go of. So we can really focus more on the liver. And there's also certain things that, certain formulations that really help with hormone balance as well. So kind of starting there alongside with nutrition, gut health, herbs, and all those things, I think can really, it helps a lot of people. And I do work with a lot of women going through that who are having some really, really good results. But I would say that if you're, just really, if you don't have the time to deal with all of that, because it does take time, with naturopathic medicine and herbs, you have to give things like 3 to 6 months sometimes. So it is a slower type medicine. So if
Yeah.
you're willing, if you got the patience and you're kind of willing to do the work, then I think starting naturopathic medicine is a great option. If you're in just if your life is unbearable and you need some changes, and maybe you've tried a lot of other things and they haven't worked, then it might be appropriate to go the bioidentical route. But there are, certain precautions to use. Like I think it's important to try to balance any estrogens that your healthcare provider may be giving you with progesterone, just to kind of keep that in check a little bit.
So if you didn't go the bioidentical route and you wanted to try the naturopathic, the slow form of the medicine, I guess what I want to ask is, is this form able to um, help more than just the symptoms? Can it help like slow down bone loss basically, and help with the things that the natural hormones would?
The short answer is yes. But it's going to depend on the person, right? I mean, some people, if they're having such a severe amount of bone loss, they might really need that sledgehammer at that time. Um, like maybe something even more than hormones, right?
Mhm.
But for a lot of people, it's really just about optimizing your own health and allowing your body to come into a state of balance. And as far as, bone health, it's, just having the right nutrients and making sure that you're absorbing them well. and also getting proper types of exercise. And, I do think that it really is our bodies, it should, like, we were designed in such a way that it was okay for us to, slow down on our hormone production at a certain age. But in this day and age, this is the time when things are really catching up with us. We've been used to going at things at a certain pace, and then menopause happens, and it's just like, wow, like I really needed those hormones, and now I don't have them anymore. And so to me, that's kind of saying that your body, needs some support. And so it's kind of like, it's not my favorite example, but I'll use it anyway. But it's just kind of like, car maintenance. So, we have these bodies, and we do certain maintenance on the car, but if we're not taking our car to someone who really knows what they're doing, then we might not get all of our systems taken care of very well. So we go our lives without really doing the maintenance that really needs to be done. And then we hit menopause, and it's just like, all right, now everything's screaming at us all at once, and we have to do something. So absolutely, I think it's okay to go for those bioidentical hormones if it makes you feel better. I absolutely don't think there's anything wrong with that. But I'm all about listening to our body, and it's so good at telling us what we need and what's going on. So that's what happened to me back when I was trying to race mountain bikes professionally, and my body was screaming at me saying, no, you need to rest. You cannot keep doing this to yourself. Because I was literally running myself into the ground on so many levels. And so, it's like our body will do that. And it's important that we stop and listen to that. And then, talk to somebody who can really help us put the pieces of the puzzle together. Because we've been conditioned to go for the drug. There's a pill for every ill and all of that. But sometimes there's more that we can do.
Sure. You gotta go to the mechanic, and it's, I was taking good care of my actual car for a while, and then I just missed a couple things, and boom, $5,000 later, here I am with a new transmission. But like maybe it could have been avoided if I did all of the recommended maintenance at a certain amount of mileage. It's too bad we don't have one of those little booklets that tell us.
Yeah, and it really goes I know exactly, if we had a booklet, because it goes above and beyond, in my opinion, what what we're told by establishments and governments and this and that about what we should be doing for our health. It really goes so much beyond what we're told. And there are just a lot of things that we knew from prior generations, different cultures around the world, different ways to support ourselves that we don't necessarily know. Like a simple thing like a castor oil pack can really go a long way. And hydrotherapy is just another tool that we've lost over. We haven't, in my opinion, respected how much water can really do for our health.
I'm pretty fascinated by when I went to visit you and you told me about your hydrotherapy technique.
Yeah, it really is amazing. It's so they've been using it in Europe for ages. It's probably been used since near the beginning of time. But and you've all heard of taking a cold shower, or doing a hot bathing session and then going into the cold and that kind of thing. So really it's the same thing, but the way I do it in my clinic is I have somebody lay on a table and I place towels on them. So hot, wet towels. And that's for 5 minutes. And then we replace that with cold towels for 10 minutes. And then meanwhile, we're doing, excuse me, sine wave electrical stimulation machine over the nerve roots that innervate the liver and gallbladder, and then also transabdominally, so over the digestive tract. So what we're trying to do here is, of course, improve circulation, but also move the lymphatics. Our lymphatic system, that is where we hold all kind of the sludge and the gunk, the toxins, the toxicity in our body. And that system doesn't have its own pump the way that our heart pumps our blood. And so we really have to do something extra to get our lymph moving. So it helps with that. It really does help with any congestion in the liver and gallbladder, and then it helps to heal the gut at the same time. So it actually can increase white blood cell counts. It's really good for your immune system. So I'm really recommending this for almost anyone that walks in the door, whether they do it in a clinic or do it at home. I was given a handout on how they can do it at home if they're not able to come to the clinic. Yeah, but it's
So I'm
just
gonna have to try one.
yes, I would love for you. Yeah, you can totally come try one anytime. I would love it. But it's a way I look at it as rebooting your system.
Lots of my clients or people that I tend to work with are very proactive with their health, which is really awesome. I feel really blessed to be able to work with people that understand that they have to take, the initiative. And a lot of them are really enthusiastic about trying herbs and such. And some people kind of try things on their own. They'll hear like maca root is good or chaste tree is good. And, I myself did chaste tree, and that enabled me to get pregnant. So, which is kind of really cool. And then I was like, oh, chaste tree is awesome. But then, I hear from other doctors that are like, you better be careful with that. And so I just wanted to know, I think there's this idea out there that because it's natural, that it's safe. And I would imagine that for the most part, that's true. But a lot of times, like, you have to be careful with like, too many essential oils and, like things like that. So if you could just speak to that briefly about what your take on that is, that would be awesome.
Yeah. So first of all, I commend all the DIYers out there, and like, all the women and all the mamas that are learning this stuff, because in my opinion, this is information that's almost like feels like it's withheld from us or something as women. And yet this is a big part of our role, for lack of a better word, so to speak, in other cultures and during different times. And so so I think it's awesome that you're out there doing that research and experimenting with those herbs. So with that said, I think that we do have to be careful with herbs. Most herbs that you're going to hear about that are hyped up are typically pretty safe in general, unless you're on medications or pregnant. So chaste tree berry is awesome. The caution with that is, like, as soon as you get pregnant, or like even if you're taking it, you might not want to take it if you're trying to get pregnant on the luteal side of the cycle, just because we don't have enough research out there saying, if there's any negative consequences to chaste tree berry in pregnancy. Is it likely that it would cause problems? Probably not. But the problem is that we don't have a lot of research to show, because we're not researching on pregnant women. So that's why in pregnancy, we kind of just really have to, it's better to have a trained professional if you're going to do herbs with pregnancy, or if you're on medications, because there are definitely things that can interact. Like, the most probably talked about one is St. John's wort, which can interact with your antidepressants. And that can create a situation that could send you into the ER. There's also some low dose herbs out there that you're not going to hear about in like the basic mainstream, that you really don't want to be messing around with, because those can lead to death in extreme situations. Most of the time, a lot of herbs, the side effects will be GI distress, but in some cases it could be. So my suggestion is to have a really good resource. I love the book Herbal Medicine from the Heart of the Earth by Cheryl Tilgner. It has a little safety profile with each herb. It also has formulas and what to do. So I, just have a really good resource that you go to, use the herbs in there, and read about the safety precautions. And if you need that extra step, then because it's always good to have someone else looking at your whole picture to make the herbs a little more effective too, because we're looking at your constitution and what herbs are going to be helpful for your constitution. And there's a lot of things that go in when we make a formula. but it certainly doesn't mean that you shouldn't experiment.
Yeah, I wanted to point that out because I know that some people have the thought of, I'm always of the thought of less is more when it comes to things like that. Just kind of like really treading lightly and having the guidance of a professional is always a good idea. And it's always good to be able to refer people to like someone like you that knows more about that. So yeah, it's just a good practice, I think.
Yeah,
All right.
sometimes people, when they're real quick, when people are taking a lot of herbs, sometimes that don't have good synergistic effects, it can affect like their heart rhythms and things, like nothing that they would really notice, but there can be some negative effects with just putting all this stuff together. So I agree that less is usually more.
Sweet. So for people that live in Longmont, Dr. April's business is called Blue Heron Natural Medicine. And tell us how people can find you. Like what's your website? And do you work remotely with people that don't live in Longmont, or how does that work?
Yeah. So if you're in Longmont, I'm in Northwest Longmont. If you know where Michelle's office is, where Align PT is, we literally share a wall. You're like right there, Michelle. So it's in Northwest Longmont, just near McIntosh Lake. And I can work remotely. There's some things to be lost. I do a lot on physical exam that really helps me work with patients in person, so it's ideal. But otherwise, I can do some remote consultation with people. My website is pretty easy. It's blueheronmed.com. So Blue Heron, it's HERONMED.com.
Awesome. And the Blue Herons, tell us about the name of your practice. I love that because, well, I'll let you explain it, but I love it because of our proximity, right? I see a lot of blue herons here. Not here in my office.
That if you see one at your office, please let me know. Like, Dr. April, there's a blue heron in my office. So blue herons, there's so much symbolism with me and my practice with blue herons, but they reside in Longmont all over, especially down at the lake. And to me, they resemble patients. They are, if you ever see them, they're always waiting in the water and they're just kind of standing there. So they're just waiting so patiently for their next meal. And it's really kind of what I feel like it's like with naturopathic medicine. It really does require patience. And they also resemble peace in Native American tradition as well. So I feel like what I'm trying to do is bring peace to people's bodies, bring peace and healing. And because they're always near the water, it's also very symbolic of how much I use hydrotherapy in my practice.
That's awesome. I love the parents. Yeah, when I'm running around McIntosh Lake and stuff like that. But yeah, I agree with the whole the slow and the patience, because to me, I don't think healing is a quick fix ever. Like I said, we're complex bodies and there's a lot going on at a given time and we're moving targets, right? So you need that guidance. So thank you very much for spending this time with me. I really appreciate getting to know you, and I'm excited to come try a hydrotherapy session. And yeah, and maybe we'll have you back to talk about other things later on in the year. So
that would be great. I would love to come back anytime. And I'm also just super grateful for you and getting to know you. And I really feel like us being in close proximity is not a coincidence. So.
No, not at all. It's very, very, the stars are aligned.